Today, we're going to be jumping right into compliance. We're going to be doing a brief introduction on how compliance applies to caregivers in the home health setting. A lot of home health care agencies establish what is called a compliance program plan. This plan looks at all of the rules and regulations and decides how exactly are we going to stay in compliance and make sure that all of these rules are maintained. Part of that plan is to make sure that we educate not only our administrative staff, but also all the employees that work for the agency. We do this by doing trainings such as this, also talking to the employees and letting them know what kind of things they should look for when trying to maintain compliance, and letting the agency know if there's anything that needs to be reported. This also creates an atmosphere created by the compliance program plan that lets the employees know that if you see or witness anything that is out of compliance, it is your obligation to report, but also that there will be no sort of ramifications against you for reporting, even if it is something that's out of compliance that may get the agency in trouble. The compliance program plan also establishes methods to audit and evaluate all sorts of things throughout the year, including client charts, employee charts, and also the techniques that we use out when providing care to make sure that the agency is staying in compliance as well as all of its employees. The purpose of the compliance program plan is to have an ongoing commitment. Compliance is something that needs to be looked at not only every year, but also daily as we're providing tasks, as we're going out and providing health care. We need to make sure that we're always following all the rules and regulations as well as any laws, standards, and ethical business practices. It holds the agency and the staff responsible and accountable for any decisions and actions they make while in the field or in the office. It offers a clear path so that we understand what needs to be reported and what doesn't need to be reported, as well as how we practice business while we are working with our clients or in the office. It keeps the agency ethically responsible, making sure that we follow all the rules and regulations that are required upon us, and it also encourages the commitment from the rest of the staff to make sure that they are also following those rules while they're out working for the agency. There is so much that goes into compliance, way more than one person can even possibly try to remember. Starting off at the top, we have all of the federal and state regulations that determine how we can do business in the United States, as well as how we can do business in the state of Texas, as well as anything that is under our guidelines as far as licensing and contracting and things like that, as far as how to be a home care agency in the state of Texas. Under that, we also have clinical standards of practice that have to do with people who are licensed and also our caregivers who are unlicensed, but also have rules of conduct that they must follow in order to practice caregiving. Below that, we have accounting and billing rules that determine what services we can bill for, how we bill for them. There's also fair label laws and OSHA. So we have to remember that we also have rules to follow that keep all of our employees safe, as well as make sure that they are paid correctly and get everything that they're supposed to. There's contract rules. We have several contracts with insurance companies. They have their own rules of conduct that they expect the agency to follow. Policies and procedures that are determined by our agency and written by our agency that all of our employees, including myself, that we also follow as well. There's tons of legal standards that keep us in compliance. And then there's also just the best practices for the business. This has to do with just making sure that looking at everything that is above, that we are making sure that we're following those rules and making decisions based off of a hierarchy of what is most important to take care of those clients and also for the continuity of our business. The administrative staff has a large responsibility in making sure that the agency stays compliant. Throughout the year, we will monitor and review the compliance plan and make adjustments according to what is going on with any legal standard changes, licensing standard changes, or anything that might impact how we're providing health care. One example of this could be COVID-19. If you recall, at the beginning of COVID, if you were a caregiver at that time, we were monitoring screening by exception, which meant you only had to report if you had symptoms. But then as the process went on, licensing made a change that they wanted people screened at every visit that you encountered a client. These would be some of the changes that the compliance committee would look at and then also inform caregivers so that they could stay compliant as well when they're out providing care. We write new policies throughout the year, and then we also do a lot of investigation when people are making complaints about the agencies or about employees or anything that is going on. We make sure that those things are investigated and that we follow through into the end of it to make sure that we come to a reasonable conclusion. So, as we spoke about earlier, there's a lot that goes into compliance. There's a lot of bodies that get to play into how we are making sure that we're doing business fairly and correctly and making sure that we're taking care of those clients when we're out there. So, if you have any doubt about if you should be doing something or if someone else should be doing something, you should always just stop and ask. The law can be really complicated, and the last thing we want is for any one of our caregivers or for our business to be in any sort of trouble. So if you're working at any home care agency, they're all going to tell you the same thing. Just stop, call, pick up the phone and ask, like, is this what's supposed to happen? Is this appropriate? Is this what I should be doing? Because it is our job as an agency to make sure that we're assisting you and informing you and educating you and also coming to those conclusions together to make sure that we put you on the right path and keep you there. As employees, we have to make sure that we are keeping up to date with our policies and procedures. These are part of our responsibilities. We also need to make sure that we're using our eyes and ears to stay involved in the situation, whether we're at a client's house or we're at an agency, to make sure that the rules are being followed for state licensing, any of those kind of things, so that we can make sure that we're working in good places, but we're also making sure we're following the rules ourselves. We also want to make good faith reports. If anybody has made a report to protective services or anything along that line, then a good faith report is just a report that you believe something might be happening. It's not really your job ever to investigate and, get all in someone's business or anything like that. But you do need to make sure that if you feel like something is happening, that you report it to the appropriate authorities. You want to make sure that you're always following compliance set by your agency. You communicate, keep your communication methods up to date, whether that's phone or email or your address. You want to make sure all of that's up to date so that your agency can reach you at all times. And you always want to make sure that you ask questions. It's very important that you not just let things go by you, but that you also ask and demonstrate your understanding of this is what is right and this is what is wrong. And also, I understand the rules that the agency has put out for me to follow. As you can imagine, one of the biggest things we see with compliance is fraud. Fraud is defined as possessing the knowledge with the willful intent to deceive. The Office of the Inspector General, also known as the OIG, is the enforcement agency for the federal government regarding any sort of medical fraud. OIG investigates and sanctions improper conduct by medical organizations as well as individuals and publishes these findings publicly on a website for the OIG. At Hire, we make sure that any caregivers are not appearing on this list, but we also have to research this list monthly to make sure that no employees, contractors that we work with, any vendors do not appear on the public list for the OIG website. So we're going to do a quick overview of a couple of different types of fraud. So a couple years back, more than a couple years actually, the government established what is called the False Claims Act. So this has to do with billing for services that were not provided. If you're billing for services incorrectly, if you're billing for services that don't meet standards of care, if you're submitting any claim that to be false, this will qualify under the False Claims Act. So that is one of the bigger types of fraud. Another one could be kickbacks, and this has to do with relationships that you have as far as how you're getting and acquiring your clients. This makes sure that agencies are using good marketing techniques when they are going out to acquire their clients, but also how caregivers even keep their clients or how other staff members keep their clients. This could have to do with an example of this would be if you are paying your client to stay on services with you, if you are paying a doctor to send you more clients, even though those clients may not need those services. That is an example of getting a kickback or being involved in a relationship where kickbacks are the method of fraud. Another couple of other examples could be with our employer concerns as far as working directly with home care is making sure that we're keeping all of our information confidential that we are not having any conflicts of interest, that we are recording our time as far as with EVB correctly. These are the kind of things that come up a lot in our home care agency. We also want to make sure that we're also abiding by our clients' rights and making sure that they have the right to choose which agency they want to be with, but also how they want their care provided. These are all sort of things that can end up on the borderline of fraud or crossing that line. So we want to make sure that we're always careful about that. At Hire, we ask that all of our employees review their responsibilities and look at the policies and procedures and sign saying that they will abide by them while working for our agency. Annually, we ask for you to recommit yourselves to following policies and procedures and also in staying in compliance. We will do our part as the administrative staff to make sure that these policies and procedures and our compliance plans stay up to date, but we would like you to do your part by signing the pledge and committing yourself to making sure that you are helping us always stay in compliance going forward. If you have any questions about this training, please let us know by giving us a call or an email, and we'll try to get those questions answered for you.